क्रॉनिक किडनी डिजीज CKD हे सध्याच्या काळातले कॉमन दुयेंस. 10तल्या एकान हे दुयेंस आमकां पळोवपाक मेळटा आनी हाजेर जर उपचार केलो ना जाल्यार पेशंट मरणूय पावता. ह्या दुयेंसांतल्यान भायर सरपाक गरजेचें म्हळ्यार अर्ली डिटेक्शन आनी क्युअर. 2040 मेरेन किडनीचें हें दुयेंस 5वें लिडींग कॉज ऑफ डेथ आसतलें अशें जाणकार सांगता. वर्ल्ड किडनी डेचो थीम आसा किडनी हेल्थ फॉर ऑल. ह्या वर्साचें कॅम्पेन फोकस आसतलें ब्रिजिंग नॉलेज गॅप्स टू इम्प्रूव किडनी हेल्थ थ्रू इनक्रीज्ड किडनी केअर, एड्युकेशन अँड अवेअरनेस इन द पब्लीक अरिना. ह्याच संदर्भात मेळोया दोतोर माधव सजगिरी आनी दोतोर अमोल महालदार आयकपा खातीर चॅलेंजिंग केसीस जांचेर ते सध्या उपचार करतात.
1954 वॉज द फर्स्ट किडनी ट्रान्सप्लांट इन द वर्ल्ड. त्या वेळा 3 वरां लागलेली ऑपरेशन करपाक आनी आज सुद्दां 3 वरां लागता ऑपरेशन टोटल ड्युरेशन. बट टेक्नॉलॉजी इम्प्रूव जाल्या. सो पयलीं जे व्हडले ऑपरेशन जाताले डोनराक ते आतां आमी लॅप्रोस्कोपीक करूं शकता. सो द पेन ऑफ द स्कार इज लेस. पेशंट बेगीन घरा वचूं शकता. वी कॅन टेक पेशंट्स हू समटायम्स डोंट मॅच ब्लड ग्रूप बिकॉज मेडिसिन्स हॅव इम्प्रूवड. पयलीं इन्फेक्शन्स चड जाताले, सो आतां वी नो वॉट मेडिसिन्स टू यूज, हाऊ मच टू टायट्रेट त्या डोजीस. हें सगळें आमकां बॅकअप आसपाक जाय. जे हॉस्पिटलांत सगळें जें आसा न्ही दॅट इट बिकम्स इजियर. म्हणून दॅट्स वाय वी आर व्हेरी कॉन्फिडंट की वी कॅन गीव व्हेरी गूड रिजल्ट्स इन किडनी ट्रान्सप्लांट.
हो अप्रोच आमकां यंग आनी ओल्ड पेशंटाक वापरूंक मेळटा काय? पळोवया अभिजीत कुमार डे हांची केस.
My name is Abhijit Kumar Day. I superannuated from Indian Coast Guard 2015 October end. Thereafter, I worked for about 28 months with Chogles of Ratnagiri. And then I constructed my house and settled at Goa.
It was a shock for me when I came to know about his kidney disease. And then I thought ki I'm the one who has to support him. If I break down myself, he will not survive.
Initially it was Bosnic cyst. Later on it became multicystic followed by polycystic kidney. And I was under treatment with effect from 2009. Last year, October, we started the peritoneal dialysis. She is my caregiver. So there is a sort of bonding between the doctor, the patient. Patient has got very little to do, and the caregiver. 3 of us together.
पेरिटोनियल डायलिसीस इज अंडरयुटिलायज्ड. पळोवंक गेल्यार आमच्या गोंयांत आतां खूब कमी पेशंट आसा. एक काळान खूब आशिल्ले पण आतां DDSSY ताका सपोर्ट करना. ताका लागून डायलिसीस पेरिटोनियल जें होम डायलिसीस म्हणटा आमी ताका खूब कमी पेशंट आसात.
I think I am doing well, and I have no intention of switching over to any other alternate method.
When we took the decision for the peritoneal dialysis, first thing was what to do and how it will be difficult and all these things. But touch wood, luckily I can say that Dr. Amol Maldhar, he has given a nice advice to us that you go through, and he and his team, they have given me a very nice training.
First and foremost thing is that you discuss frankly, threadbare all we call it. Sit down across the table, take your caregiver or your wife there, take your other relatives if possible, and talk to him, he will explain you.
म्हणजे पेरिटोनियल करतले जाल्यार तांकां आस्थमा आसपाक जायना, लंग्स प्रॉब्लम, किंवा तांकां हर्निया कसलो आसपाक जायना, किंवा प्रिवियस कसले अबडॉमिनल स्कार आसपाक जायना, किंवा कसले कॅन्सर जावं ते स्टोमा बीन तसले आशिल्ल्या पेशंटांक आमी एडवायसूच करिना.
When they started his peritoneal here, I was asking the other technicians that can you come home and give me a support for few days till the time I learn it. But then luckily in here only it took hardly 3 to 4 days to me to learn it.
This suits us very much, that in the comfort of your home, TV, and in the home environment you are doing it, except you have to be very careful about the hygiene.
होम डायलिसीस केल्ल्या पेशंटांचे आउटकम जे पळयले आमी न्ही इंटरनॅशनल रिसर्च पळयल्यार एक्चुली पयल्या 2 वर्सांक होम डायलिसीस हॅज बेटर सर्वायवल दॅन पेरिटोनियल डायलिसीस. आनी प्लस तांकां वॉट इज कॉल्ड रेजिड्युअल युरीन आउटपूट जें आसा न्ही किडनी फंक्शन तें प्रोटेक्ट जाता. जेन्ना आमी हिमोडायलिसीस स्टार्ट करता तेन्ना विदीन 2-3 मंथ्स ते एनेफ्रीक जाता, म्हणजे तांकां युरीन आनी येना. वेरेज पेरिटोनियल डायलिसीस केल्ले पेशंट दे कंटिन्यू टू पास युरीन फॉर 1 year 2 years आनी दे हॅव दीस एडवांटेज. सो डेफिनेटली PD इज अ चॉयस दॅट पेशंट शूड टॉक. आपल्या दोतोरा कडेन उलोवपाक जाय की इज इट सुटेबल टू मी, कॅन आय डू इट, आनी इफ ही कॅन डू इट इट्स अ डेफिनेटली गुड चॉयस.
First of all, we don't have to travel every alternate day to come and spend 4 hours for the hemodialysis. First you have to take the slot, you have to wait, you have to travel, means 1 full day it's going to be spent.
I can do the dialysis myself in emergency, but the dressings I cannot change because it is in such a place I have no visual access to this one. So she is stuck, her work is suffering.
There's one thing you said, कुछ पाने के लिए कुछ खोना पड़ता है, but and you have to give the priority, and my priority is my husband. I have to keep him happy, so I don't mind if I have.
You have got very little role to play because they're doing everything and you are just following maybe little constraints on your diet. You have to follow the doctor's advice and you're fine kicking.
The government has to support peritoneal dialysis by including it in the Deen Dayal scheme. It will be a big help if there are patients who get converted to peritoneal dialysis. The burden on our hemodialysis centers will go down. The morbidity of travel and various issues surrounding that will come down. Automatically patients will be able to manage their own health like he is able to manage. I don't say it's suitable for everyone, but whoever is suitable, if they have are not doing it because of the cost factor, then if government gives us help, then we should appeal and
In fact, some organizations have realized the benefit, and in fact railways and all, they want to promote peritoneal dialysis because the cost of delivery of peritoneal dialysis is lesser than if you have to set up a hemodialysis setup.
To do home dialysis or hemodialysis, again it should be sorted out by the caregiver and the doctor and yourself. Nobody else can advise you better than this. It is the doctor will tell you whether you are a fit patient for peritoneal dialysis or not. The caregiver has to take the challenges for giving care, and mind you, it is not for a day, not for 2 days, not for 5 days. It is your entire life. So she will be locked in home during those time. Means she has to go in emergency for somewhere, or you have to go. You are in your home. It has to be well planned.
You have to give 2 hours a day. That's it, not more than that. And I think 2 hours is not a very big challenge for you. And I feel that people should opt for this one because I'm finding it very comfortable because I don't have to travel, and at home also, according to my convenience, I can do. Yes, I have to be very careful about the hygiene. That's it, nothing else.
दुसरी गजाल जी आमकां प्रामुख्यान आयकोंक येता ती म्हळ्यार डायलिसीस. डायलिसीस ही प्रक्रिया आमकां केन्ना सुरू करपाक मेळटा?
जेन्ना CKD जालो न्ही ताका, क्रॉनिक किडनी डिजीज बेगीन आयलो, सो तें काम जनरल प्रॅक्टिशनर दोतोरान करपाक जाय, ते अवेर आसपाक जाय. ते आमचे कडेन जर टायमार आयले न्ही जाल्यार वी गो ऑन फॉलोईंग देअर क्रिएटिनीन, तांचे वेट कितें आसा, तांचे सिम्पटम्स कितें आसा, त्या प्रमाणे वी मेक अ एस्टिमेट. एंड इट इज नॉट बेस्ड ऑन प्युअर नंबर्स, ताका कितें फॉर्मुला ना. It is a holistic approach. That's why medicine is more art as much as it is science. So we make a plan targeting that, okay, this patient might need after 6 months. Generally indications are that he is going on losing weight or he is putting on too much weight. His creatinine is going on increasing. Generally it is crossed 6, or his potassium is increasing, or his blood pressure is going through the roof. So these indications, then we tell them, okay, you have to go for a fistula creation. Because for dialysis we require a road access करपाक जाय. आणि then we also talk to them about transplant, because जर transplant possible आसा, we can do what is called preemptive, की डायलिसिसाचेर वचनासतना ट्रान्सप्लांट करपा जाता. कारण तातूंत कितें आसा तेजे बाकीचे ऑर्गन्स वील नॉट मीट द बॅड इफेक्ट्स ऑफ अ बॅड किडनी. सो वी कॅन डू अर्ली ट्रान्सप्लांट.
मेळुया 30 वर्साचे उदय पटेल हांकां आनी तांची केस जाणून घेवया.
I come from Madhya Pradesh, from a very like interior of Madhya Pradesh, if you say. So from last 10 years I am in Goa and working with the same organization from last 10 years. There is something called RCC, renal cell carcinoma, and my wife is a medical professional, so she came to know everything, but she was also not telling me ki what is there. Then I told her, Baba, tell, otherwise I will more tensed. Then she told, straight away she told, you have cancer. From there I came back. Next day I came to Manipal Hospital, came to Dr. Salkar. So when I went there, he called Dr. Madhav from his chamber. So I was there on his table, and like I was lying down, and Dr. Madhav came to check. Then he did my checkup and saw all those reports, so which was saying it is completely renal cell carcinoma case.
He had bilateral renal cell carcinoma. It's a very, very, very rare situation, and he was lucky that it was within both the kidneys. Now when both kidneys are involved, we try and do something called as a nephron sparing surgery, where we try and salvage some part of the kidney. With advanced technology we are able to do this now, where we don't remove the entire kidney and remove only a part of the kidney surrounding the tumor. Now his initial scans which were done were indicating that one side it was extensive and the other side it was located only to one area of the kidney. So we initially felt that we could probably salvage one part, one half of his one kidney, so that at least that will keep him going for some time.
They decided, let's do one PET scan for him, so that PET scan will get clearance whether cancer is there only in one kidney or all the cysts are cancerous.
Cancer trumps everything, because if we don't treat the cancer, he will not live. But removing both kidneys and making him anephric can be tackled with dialysis, and with future transplant, once he crosses that time period of 3 years where he is cancer free, then we can. So there is a solution to that, but there was no solution to the cancer. So it's a very extremely rare situation.
Initial treatment which was there decided ki we will remove one kidney, it converted to another situation, we will remove both the kidneys. And then Dr. Amol Maldar came in picture, because if I lose my both the kidneys, then who will look after the surgery?
यंग मॅन, ताका कॅन्सर, दोनूय किडनीनी कॅन्सर. सरान आपयल्यान सांगलें की दोनूय किडनी काडपाक जाय. सो पेशंट बेजिकली एनिफ्रीक, ताका आतां किडनी ना. सो आफ्टर ऑपरेशन विदीन 6 hours ताका एक डायलिसीस लागतलें. So before operation only we plan to put a tunnel catheter for him. Then he undergoes the surgery. Then we put him on dialysis, and then we go on doing dialysis for some time. After that we created a fistula for him. And ata he is doing on fistula the dialysis.
So those all questions were there before coming on dialysis. I'll be able to work or not, what will happen. Then Dr. Amol has given a support to me. Nothing will happen, you will be absolutely fine. Everything I got support from Dr. Amol, because he has told me there are many people who is working like on dialysis, everything they are doing, no problem. Only thing, you need to come to the hospital and spend some time with me. He told like this. Initially, like 2-3 months, there was a problem, like management problem. It's not like ki nahi ho sakta baba. So in 2-3 months I got settled and everything came on track. See, if you skip the dialysis, first thing, you know, in a dialysis you don't pass urine, you only drink water. So when water is there in your body, you will feel heaviness. You are slowly, you are like restrict on a way. Like you cannot, after one dialysis, if you skip, like my experience, if you see, I can survive 2 days without any problem. But third day, like second day itself, in the evening, if I'm not coming dialysis, I feel little heaviness in my body. If I skip one more day, I will not be able to walk. Somebody has to carry me to the hospital. So don't come to that situation. It is unmanageable for you. So you need support. And I am staying alone. So I cannot afford that. Somebody should carry me to the hospital for dialysis and all. So never ever escape a dialysis. And I never tried and not planning in future also. I have all brothers, sisters, everyone is there. But some people, those who are ready to donate, they are not matching with my requirements. And they are, the people who can donate, they are like not ready to donate. So these all things are there. And hope so for the better future.
Cancer patients are not advised transplant unless they are cancer free for a period. In his case, that is 3 years. So after 3 years, we have repeated the PET scan and now we know there are no active disease anywhere. Now he is fit for transplant. But last 2 years, he is still waiting, taje turn kenna yetle. Problems are, availability of donor, getting on the list, waiting for time on the list. So we are hoping that one day we will be able to help him as well.
People are not aware of donating their organs after their death. So I'll say, donate your organs. If you are not there in the world, you can be alive with some other persons like me.
He's doing everything. It's an example for anybody to follow. And I wish that his family members who are having matching parameters come forward one day, or he gets a
Yeah, because
cadaver kidney
living
soon.
donation definitely is better than deceased because we can plan it. And outcomes are 2-3% better than with a deceased donation.
You can survive for years through somebody else. This way you can think of.
रिनल फेलियर हाका मल्टीडिसिप्लिनरी जॉब अशें कित्याक म्हणटा?
Renal failure is a multidisciplinary approach. It is not one person's job. It is a team job. If at all you describe a teamwork for any pathology, this is the best example of how a variety of health professionals come together to do this one procedure on a day. And it has a lot of cooperation between experienced members of this. It's called as a transplant team, where on one side we have the nephrologist, who is Dr. Amol. On the surgical side, we have myself along with a vascular surgeon, along with a laparoscopic surgeon. Our vascular surgeon is Dr. Rakesh, a laparoscopic surgeon is Dr. Jagannath. For our initial transplants, we have an expert coming from Bangalore, Dr. Dubey, who has done several number of transplants. So he acts as a mentor or a proctor for our program. We have experienced anesthetists, we have an ICU team, we have well-trained medical officers, well-trained nurses, technicians, and lot of other people who work around the main core team, where initially there is a lot of paperwork, lot of legal documentation. So all this is taken care of by many people. So it's a multidisciplinary approach, it's a team job, and we have a well-oiled machinery here now, where everyone knows what has to be done to make it a successful program.
ललिता चव्हाणाची केस असा एक सक्सेसफुल किडनी ट्रान्सप्लांट. ऐकूया तिची काणी.
ललिता चव्हाण. आमी एक्चुअली कर्नाटकच्यान आसा, गोंयान रावले ते खूब वर्सां जाले अशें एसिडिटी म्हणून इतली सांगले तेच कळले. मागीर सराक मेळले तर ते दुसरे सरांनी अमोल सरान सांगले दोन्ही किडनी फेल आसा म्हणून डायरेक्टली. आमकां कांयच कळोंक ना तेन्ना कितें करपाचें कशें कितें काय म्हणून खूब म्हणून तरी खूबच भिरांत जाल्ली आमचेर. खूब कठीण आसली सर आमची लायफ तेन्ना. आतां बी सद्या म्हणलें तरी आमकां देवाचेर खूब विश्वास आसा. खूब म्हणलें तरी खूब. अशे दीस नासले आमचे पयलीं 15 म्हयने आमचो घरा असोच जातलो काय म्हणून अशें आसलें. मागीर एकदां ट्रान्सफर करून आमी घरा येयली ती दुसरीच लायफ कशी जाली एकदम परफेक्ट. आतां कांय ना कशें. आमगेर कोणूच पेशंट ना कशें आसा सर आमी सद्या कोणूच पेशंट ना. ती नॉर्मल केन्ना कोणी जावं शकता एक्चुली कोणूच ना कशी. तेन्ना आसले पळय आमगेर 15 म्हयने दीस काडले आमी ती कोणी काडूं नाका. कितें आसा पळय कितें आमचे कडेन ना जाल्यार दुसरे कडेन घेवन ट्रान्सफर करून बरी लायफ जिया कोणी आसा ते. आनी कोण दिवपाचो आसा न्हू तो भिवपाचें ना. आतां आमचे घरान आसा पळय सद्या भिवपाचीच ना. म्हजी आई सगळीं काम करता. आमची खेताची काम आसता कितें आसता सगळीं करता ती. आजुनी करून आजुनी आपणूच जेयतना आपणूच करून सगळें काम करता सर ती. तेजे खातीर सांगता सगळे कोणूच भिवपाची ना. आमी भिवन फाटीं सरलेले. मागीर एकदां घोवान सांगलें नाका विश्वास करुया आमी. पयशाचे पडलेले ना विश्वास करुया म्हणून फुडें सरले न्हू बरीच जाली सर ते. फुडें सरले लायफ फुडेंच जाली सर ती. फाटीं पळोवपाचेंच ना ते आतां सद्या म्हणून तरी फाटींच नाका आनी फुडें खूब वचुया.
एलिजिबल कोण डोनेट करपाक कोण म्हणजे कोणूय जो पळय 18 वर्सां वयर आसा आनी 60 वर्सां सकयल आसा. सो एज इज इम्पॉर्टंट कोण डोनेट करता तो मनीस ताजो स्वताचो रिलेटीव आसपाक जाय आनी तो ही शूड बी गिवींग इट आउट ऑफ लव एंड अफेक्शन नॉट एज सम कायंड ऑफ अ ट्रान्जॅक्शन. देर कांट बी मनी एक्सचेंज ऑर एनीथींग. देर शूड बी नो प्रेशर कोवर्शन आसपा जायना. कोणे कोणाचेर फोर्स करपा जायना. Preferably we want the same blood group, but now it is possible to do what is called across blood group also. It is more demanding, slightly more expensive, but it is possible. That person should not suffer from diabetes, blood pressure. If on blood pressure, he should be on 1 or 2 medicines only. Should not have any other major ailments. So हे सगळे आमी टेस्ट करता आनी ही जी प्रक्रिया आसा न्ही टेस्टिंगाची दॅट इट सेल्फ टेक्स 2-3 weeks. प्लस मागीर आमी ताजें सगळें डॉक्युमेंटेशन तपासता की तो खरोच जेन्युइनली रिलेटेड आसा काय ना तो. गव्हर्मेंटाचें परमिशन लागता. सो हें सगळें करपाक वी रिक्वायर सम टायम. सो त्या टायमान पेशंट हॅज टू बी कंटिन्यूइंग ऑन डायलिसीस. सो डायलिसीस सर्व्स एज अ ब्रिज.
सरान सांगलें ना अशें कांय ना ट्रान्सफर जातलें तुमी भिवो नाका. कितें आसा तें आतां मातशें फास्ट करुया आमी. मागीर उपाय खूब आसा. डायलिसीस केले खूब 15 म्हयने डायलिसीस केले सर. एक दीस घरा तो 2 दीस हॉस्पिटलान. मागीर सरानूच सांगलो खूब कंटिन्यू जाले. गॅरंटी बी अशें कांय ना तुमचे.
पयलीं सांगलें तेन्ना सगळीं शॉक आसलीं आमी. खूब म्हटल्यार खूब शॉक आसलीं आमी. भिरांत दिसताले. आमी धाकटी आसलीं तेन्ना ती आसनाली चडशे आमचे कडेन. मागीर सगळीं तेका हें करतालीं.
हांवें सांगलें दोनी जाय जाल्यार दिता. भिवपाचें कांय गरज ना. घोव आनी आईचे आनी भावाचे खूब आतां 5 वर्सां जालीं सर ट्रान्सफर केल्ले तेजे पयलीं 1.5 म्हयने म्हणून तरी 6 वर्सां तरी जाले 7 वर्सां ट्रान्सफर केल्ले तेजे मागीर दुसरी नई लायफ मेवले कशी जाले. दुसरी लायफ.
Major part of the fear why a person doesn't come and donate is that something will go wrong with me. I'll have a big scar. I'll have a lot of pain. These are the common things which family members come, and then we have to alleviate that situation. So now what we do is the retrieval of the kidney from the live donor is done laparoscopically, which is a keyhole procedure. And with the latest technology available, we have done transplants in our hospital at Manipal Hospital with laparoscopic donor retrieval of the kidney. and the donor has practically no pain post-operatively, and patient goes home on the third day. So it's an excellent method to do this transplant. The donor has the advantage of becoming active immediately after the discharge and lead a normal life after that. We are the only hospital in Goa who is doing this. Laparoscopic kidney retrieval is not done anywhere else. So we should encourage more patients to come forward so that, and create awareness so that they come without fear, and we'll have more and more patients who are on dialysis for years together who will get converted to a transplant and lead a much better quality of life.
पयलीं भिरांत दिसलेलें सर, करपाचें कांय ना म्हणून. मागीर सरान सांगलें भिवपाचें कांय गरज ना, करून घेया. मागीर घोवान फुडें सरलो, जाता तें जावं, करून घेवया. मागीर आमकां ते डॉक्टरांनी सांगलें कांयच ना हेजेर, कांय ना, कितें करता, वेस्ट जाता तुमचे खर्च. घोवान सांगलें देवाचेर विश्वास करता आनी तुमचेर. 2 लोक आसा म्हाका आतां फुडें, मेन तो, मागीर डॉक्टर. घोवाचेरूच खूब सपोर्ट आसा सर.
आता गव्हर्मेंटान जर आपल्याकडे हॉस्पिटलांनी फुकट ट्रान्सप्लांट केले आपली सिस्टम यूज करून, आणि त्या मनशाक जर परत सोसायटीन कामाक लायलो जाल्यार इट्स अ बीग गेन टू द सोसायटी. कारण डायलिसिसान फक्त पेशंटच न्हय, ताज्या बरोबर एक केअर गिवरूय आसा. सो 2 मनशां आर आउट ऑफ द सिस्टम. दे हॅव टू देन बी डिपेंडंट ऑन each other, and many times they lose their job. Fortunately, we have been able to help patients keep their job and continue to work and do dialysis, but it's not always possible. So transplant definitely is the more rehabilitating therapy if it is possible.
पहिले 15 दिसांनी मेवताले सर, मागीर 1.5 महिने 2 महिने, आता 2 महिन्यान मेवता सर. 2 महिन्यान एकदा सराक मेवता सर. तुमचे भाशेन नॉर्मल आसा, आमी तरी ट्रीटमेंट आसा आमकां चालू, आमकां मेडिसीन बी चालू आसा, तेका कांय ना. तुमी कशी आसा पळय तशी आई आसा, आमकां चालू आसा, पेशंट न्हू, आनी तेका कांय ट्रीटमेंट ना, तेका ना डॉक्टर, कांय ना सर.
एक बरी गोष्ट आसा की गोवा गव्हर्मेंटान सोटो आतां एक्टिवेट केला फाटल्या 2 वर्सां. ताका ताणें एक बरें सुंदर नांवूय दिलां, नवें जिवीत. आनी ती सुंदर काम करता. डॉक्टर प्रीती वर्गीस जी थंय जॉयंट डायरेक्टर म्हणून आसा, व्हेरी एक्टीव, आनी ती खूब अशे अवेरनस प्रोग्राम करतात. तातूंतल्यान त्यांनी 2 डोनेशन्स केले फाटल्या वर्सां भितर. सो 4 जाणांक जीवनदान मेळ्ळें किडनीच्या पेशंटांक. पण लिस्टार खूब पेशंट आसा, ऑलमोस्ट 28-30 पेशंट ऑलरेडी आसात, आनी अजून खूब आसात जे लिस्ट जावंकूय ना. सो खूब काम जावपाक जाय ह्या दृश्टीन की तांकां सगळ्यांक मेळपाक जाय.
मणिपाल हॉस्पिटल्सची टीम फाटली काही वर्सां किडनी पेशंटाक आपल्या हॉस्पिटलाच्या वरवीं ट्रान्सप्लांट, डायलिसिस सारखे ट्रीटमेंट दीत आसा. तांची पुराय टीम तोखणायेचें काम करता. जागतीक किडनी दिसा निमतान जाणून घेवया दोतोर माधव सजगिरी आणि दोतोर अमोल महारदार हांचे विचार.
We have excellent transplant team. We use the latest technology. We use the safest methods, and we've had good results with whatever we have done so far. So I would appeal to people to register for deceased donor program, and those who are able to donate to their loved ones as a living related donor, please come forward and come without fear and help your loved one to get on to a better quality of life, and it reduce the burden on the family as well as society in general.
Doctors and our organization especially takes complete care and precautions की ताका कांयच जावचें ना. If we have one iota of doubt, आमच्या ट्रान्सप्लांट टीम मिटिंगेनूच आमी क्लियरली सांगता की बाबा तुका हें इज नॉट अ गुड आयडिया. So we select and pre-screen donors very carefully, so they should not have any inhibitions to donate. आणि let's hope that they नवे जिवीत जे आमच्या गव्हर्मेंटान स्टार्ट केलां ताका चड प्रतिसाद मेळचो. म्हजी इतलीच अपील की वी डोंट वॉन्ट मोर ब्रेन डेड पीपल इन द रोड. सो यू प्लीज वेअर युअर हेल्मेट, फॉलो ट्राफीक रुल्स, वेअर हेल्मेट, ट्रॅव्हल सेफ. आतां रोड इतले बरे जाल्यात, पण लेन डिसिप्लीन इज इम्पॉर्टंट. पण बाय चान्स सपोज समबडी मीट्स विथ एन एक्सिडेंट आनी ब्रेन डेड जर जालो जाल्यार प्लीज ट्राय अँड हेल्प अनदर फॅमिली. आनी आमच्या एका पेशंटान बऱ्या शब्दांनी स्वताचेच सांगलें न्ही, इफ यू आर नॉट अलायव आय वील बी देर, यू वील बी देर थ्रू मी एज अ अँड नॉट जस्ट मी, देर वील बी सो मेनी पीपल. एटलिस्ट 8 जिवनां वाचतलीं, म्हणजे 2 किडनी, हार्ट, लंग, लिवर अशे कित्येक लोक आसतले. सो ताका लागून इट्स इम्पॉर्टंट पीपल कम फॉरवर्ड टू रजिस्टर अँड डोनेट आफ्टर दॅट.
There are some countries where everybody is presumed to be a donor. So we have a long road to that status, but we should keep taking steps to finally reach there. I think that would be
proudly I have to say that our hospital was the first one to do a multi-organ donation way back in 2018. But now Goa is taking steps to go ahead. We are hoping ki 1 becomes 2, 2 becomes 4 and 4 becomes 16. And if we are able to do that, there won't be even a wait list. We assume की गोंयान साधारण 200 लोक दर वर्साक आसा जेंकां डायलिसीस नवे सुरू जाता. पैकी कमीत कमी 40-50 अशे आसतले जेंकां ट्रान्सप्लांट सुद्दां जावपाक जाय, पण इतले जायनात न्हय. सो वी वॉन्ट टू रीच दॅट नंबर सून अँड टुगेदर वी ऑल कॅन.
आजकालच्या धांवते जिणेंत आमची हेल्थ फाटी पडटा. आमकां वेगवेगळी दुयेंसां जाता. क्रॉनिक किडनी डिजीज अशेंच एक दुयेंस. किडनी दुयेंसाक मात आमी अर्ली डिटेक्शन आनी क्युअरांतल्यान करूं शकता. हें आमकां दोतोर सजगिरी आनी दोतोर महालदरान सांगलें. अभिजीत कुमार डे, उदय पटेल आनी ललिता चौहान ह्यो फक्त केसीच न्हय तर सीकेडीक मात दिवपी उदाहरणां आसा. ह्या कार्यक्रमांतल्यान आनी एक मेसेज आमकां मेळ्ळी, ती म्हळ्यार ऑर्गन डोनेशन. ऑर्गन डोनेशनांतल्यान आमी दुसऱ्याक एक नवें जिवीत दिवपाक शकता.